Hello everyone, my name is Brosch-Lenz and I'm more than happy to present the results of our investigation on the validation of a simplified single time point image-based dosimetry approach for the lutetium-177 PSMA therapy. I have nothing to disclose. As a quick introduction, I would like to point out that the lutetium-177 PSMA therapy has evolved as a promising treatment option, especially for patients suffering from metastasized prostate cancer. However, the absorbed dose calculation here is essential for the patients to ensure a safe and efficient treatment. But the dosimetry typically requires quantitative lutetium-177 imaging at multiple time points post-application of the radiopharmaceutical. This is illustrated here on the right. You can see 3 SPECT images with 3 bed positions, 24 hours, 48 hours, and 72 hours post-injection of the radiopharmaceutical. However, this is not optimal from the patient's perspective. These patients suffer from extensive pain and they have metastasization, especially to the skeleton. So laying still for a long time and coming back repeatedly for the measurements puts a lot of burden on the patient. And in addition, we have additional workload for the personnel. And in some centers performing the lutetium-177 PSMA therapy, we have in addition also limited SPECT camera availability. All these factors hinder the routine and multiple time point image-based dosimetry of lutetium PSMA. Now, the activity uptake does vary in the organs and in the tumors, not only over time, but also between patients. This is an example of one patient with different volumes of interest of organs and tumors. We can see the time and activity concentration curve, and we can see the different shapes of the time activity curves and also the different uptake. So we wondered, can we reduce the number of required imaging time points? In our institution, we typically have 3 imaging time points, 24 hours, 48 hours, and 72 hours post-injection. Furthermore, we wondered if we could, for example, benefit from the knowledge from the first therapy cycle when we perform multiple time point imaging, and if we can use this information for the subsequent therapy cycles and possibly reduce the number of required imaging time points there. The methods of our study included 10 patients suffering from metastasized castration-resistant prostate cancer. They all underwent a first and second therapy cycle of lutetium-177 PSMA therapy. And we performed, as already mentioned before, 3 SPECT-CT imaging time points post-injection, 24 hours, 48 hours, and 72 hours. We performed quantitative SPECT imaging of the lutetium, including scatter correction, attenuation correction, and collimator modeling. Furthermore, we include 3 bed positions of the SPECT imaging, therefore covering an area from the shoulders to the knees approximately of each patient. We further performed rigid registration techniques from all imaging time points to the first imaging time point. And we segmented volumes of interest for the kidneys and bone lesions for the first and second therapy cycle respectively. This is an example of one patient. You can see the CT image, the related SPECT image, the volume of interest map of the 2 kidneys and of the lesions in the skeleton, and the fused image on the right. For the fitting, we used here a mono-exponential approach, which is shown here in green, with the time and activity concentration curve here, and the volume of interest activity is also indicated there. The time activity fitting gives us the effective half-life per volume of interest of the first and second therapy cycle from the multiple time point imaging, which served as the ground truth here. For the dosimetry, we performed VOI-wise time integration as well as using the mirrored formalism with the mass-scaled organ and tumor S values. For our proposed single time point approach, we used the effective half-lives from the first therapy cycle in combination with either the 24 hours, 48 hours, or 72 hours SPECT scan from the second therapy cycle. We hence compared the percentage difference of the absorbed doses for the second therapy cycle from the 3 individual single time point approaches versus the multiple time point approaches. For the results, we assessed the left and right kidney individually and also grouped the whole tumor burden in the skeleton in a single VOI, plus up to 4 individual lesions per patient were also compared. And having a closer look at the percentage differences on average, plus minus the standard deviation here, What we see is for the kidneys that we underestimate using the 24-hour scan for single time point image-based dosimetry, while 72-hour scan is overestimating the absorbed dose by almost 15%. Using the 48-hour scan, so day 2, we only had 0.1% difference. For the whole bone tumor burden and the individual lesions, we always saw, and similar applies for the kidneys, that the 48-hour scan single time point dosimetry had the smallest deviation from the ground truth of multiple time point dosimetry. Similarly, this is highlighted here in the kidney example. In red is the area under the curve of the multiple time point dosimetry approach and the single time point approaches of the different days, showing that the 72-hour scan would largely overestimate that area under the curve. To conclude, we saw that single time point image-based dosimetry for lutetium-177 PSMA therapy is feasible. Using the effective half-life from multiple time point imaging of the first therapy cycle for single time point imaging for the second therapy cycle was of advantage. The errors were smallest with a single time point at 48 hours for the second therapy cycle, and in addition we saw that our errors were smaller than 5%, which is really small in terms of dosimetry. As an outlook, we would like to investigate this also in a larger patient cohort, as well as to include more organs and also soft tissue lesions in prostate cancer patients. Of course, we would also see, is this approach still valid for subsequent therapy cycles larger than the second therapy cycle? Thank you very much for your attention, and please feel free to contact me in case you have any questions via email. I will be happy to discuss with you.